Welcome everybody. So it's good to be back. Good to be back working with you again, Christina.
I'm glad you're back.
So I'm of course Bill Code, and this is Christina Mitz, my associate, and she's been carrying on working with people in my absence, and it's a great help. So if you want to find Christina, go to Mind Mood Microbes, and if you want to contact her, go to mindmoodmicrobes@gmail.com. Well, I remember that much. And then, of course, you know, it's a good time if you folks want to share this with your other folks on Facebook. And if you have friends or associates that want to learn more about it and they're not on Facebook, and some people are now off Facebook for any number of reasons, it's a complicated time, then they can go to drbillcode.com, DRBILLCODE.com, and click on blog. And all of our previous blogs are on there that we've done together. Some, of course, that we did with Dean from Australia, and others as we work forward.
So today's talk is on cannabis. So I think Dr. Code is going to give just a bit of an intro.
That's right, because cannabis is a big topic. Most chapters in my book, if any of you that have it, Solving the Brain Puzzle, are 10, 12 pages. The one on cannabis is 48. And there's several other pages. So there's over 50 pages in the 600-page book talking about cannabis and many, many references. I really wanted to focus on cannabis, and we'll probably do it in at least 2 sessions, because I know we've already had a lot of questions, and we've got those with us, and we're going to go through those in a minute. And you're encouraged to come up with other questions, and we'll try and deal with them as we go along. Cannabis, of course, has been used for nearly 5,000 years by humankind. You know, it's in the Siberian seeds. They can find on grave sites. It was used in India for probably 5,000 years. It was used in Egypt. It's in their ancient medical texts, and it was used by other groups for a very long time. It's much more recent. It fell into disfavor about 100 years ago, mostly on a political scene. Maybe a bit of an interesting time. Everything today is on a political scene almost, even though it doesn't make any difference in the medical scene. But it's really, I think, come into its own, especially in Canada. I mean, I'll give us Canadians and Health Canada full points because we've had it medically available since 2001. So I've been writing scripts for it for over 10 years, and probably for hundreds of clients that have helped immeasurably. I've never seen anything as helpful from a pharmacological aspect. And so it becomes part of the armamentarium within functional medicine, because now it's available recreationally, legally in Canada and in many parts of the world, not all. Mexico is in the process of making it readily available, as well as, you know, medically. And of course, Uruguay, like Canada, has also made it acceptable across the board. So most of us can find it. However, you know, that previous history has carried over and it's skewed some of our ideas, and that leads us into the questions. But I wanted to make credit, first of all, to Raphael Mechoulam, who's an Israeli who in the early 80s discovered the cannabis receptor, okay, in the human body, and it's present in vertebrates way back, so a long time. So that helps us understand. And then he discovered anandamide, which is Sanskrit for bliss, and that acts very much on the CB1 receptor, which is very dominantly found throughout the body, but especially in the brain, the reproductive system, and some other components. He also went on to discover the CB2 receptor. So these receptors are in human anatomy all the time in everyone. Just like you're used to hearing about opiate receptors, which is, you know, metenkephalin and beta endorphin. There's 2 major ones, and then there's subsets of the receptors. But those same ones happen in the so-called inside the body or endocannabinoid system. And so once you understand those we already know now that there's some illnesses, and these are tricky to measure. You have to measure them almost in minutes after you take them from the body. But we know that in illnesses like fibromyalgia, migraine headache, irritable bowel syndrome, and even in anorexia nervosa, some of us have a relative minimal amount or not quite enough of those inside the body endocannabinoids. As a consequence, if you raise them up, and one way to do that is with cannabis or a derivative of cannabis, then all of a sudden those people can be normal, which is really exciting news, I think. There's no question. So the CB1 and CB2 receptors, pretty easy to remember, 1 and 2, those are in the body. And those are one of the main focuses that things work on when we talk about the components of cannabis itself. So the other one inside the body is 2AG, and that's a lot simpler than the complex chemical name, so we'll just call it 2AG. It would be really brilliant and easy for all of us if we knew that the THC, which is known as I call it the trippy component in cannabis plant, but it's the one that's got all the press over the years. It's the ones that makes us spin out, euphoric, and even unpleasantly euphoric, okay? Which trips some people out and even will induce a temporary psychosis. Now, contrary to what some people suggest, it does not trigger schizophrenia, okay? And if you take that person and put them in a careful room, quiet environment, in 2 or 3 days, because the drug THC takes a long time to go down. And that's why it's present for a month after people take it. Mm-hmm. And that's why when they go to work in the north of Alberta and there's zero tolerance, then all of a sudden, they can't do a urine test for a month after. Consequently, they survive on cocaine and alcohol and opiates. Right. Tragic, but true. So that's the one that's given all the press, because in recreational cannabis in Canada, United States, Europe, and most of the world, everybody bred strains of cannabis that were high in THC, because that was the market. Mm-hmm. People tripping out, young people tripping out, association. But the big news in the last 2 decades at least has been CBD, cannabinoid, cannabidiol. So THC nearly works primarily on the CB1 receptor. However, if you have some CBD present, you don't get as trippy because it calms down the action of the CB1 receptor, but you can still get some of the benefits of THC. So CBD, if life was simple, it would work straight on the CB2 receptor. It's not really so. It effectively becomes a little bit like acting on the CB2 receptor because it slows down the enzyme that breaks down 2AG, which, remember, worked on the CB2 receptor. So by doing that and working on a few other receptors like the TRPV and the others, that's why it can become quite an excellent antidepressant, antipsychotic. A great study out of France that I talk about in the book, they went head to head with CBD versus a really new quality antipsychotic from France. And what they found was they worked equally well, but the CBD had virtually zero side effects. Whereas any antipsychotic, because it works so much on the dopamine angle, it's got some really rough side effects. And that's why people don't like to take them, because they feel dreadful, groggy, all those pieces. So the CBD will be a considerable part of our discussion points, because that's where there isn't enough information known yet by the general public, i.e. you folks. So it's good to have many of our regulars back, so welcome back everybody, and thank you for the questions. We're going to go on further just with an outline of a couple things, and then we'll come back to these in the question. So if you're worried about arthritis pain, then you might try pretty well pure CBD. And if you're worried about chronic nerve pain, then you're probably going to end up with a ratio of 4 THC to 1 CBD. And most people can handle that pretty well. If you look at the old available cannabis strains that people were all enamored with because they made recreational people very trippy, then they were often 20 to 1 THC to CBD, or even 30 to 1. Every time you move the THC up, usually the CBD went down. One of my favorite ratios is 1 to 1, okay? THC to CBD. And that's what I recommend for sleep, often for people start, especially in the cannabis naive, which most people are, especially most are older people, right? So, if we understand that, so I've talked about 3 groups. High CBD on its own, especially as an anti-anxiety and these sorts of things. A combination of 1 to 1, a good starting place, and 1 for sleep. Actually, I can sleep pretty well with 10 milligrams of THC, 10 milligrams of CBD. So one place I'm on medical cannabis partly for my multiple sclerosis. And I like it in MS patients because it's dramatic. It eliminates 3 or 4 other drugs that they take, which is a way simpler for them and a lot less downside and a lot less addicting than all the other choices that they tend to put us on. So once we've been through those steps, I think we'll start to edge into the questions, and then you folks can come up with other questions as you come along.
But before we do that, so Bill has been talking about the different types of cannabis. So he's mentioned THC, he's mentioned CBD. There are actually other ones as well, but those are the 2 main ones, so that's what we're going to stick to. If you have Solving the Brain Puzzle, there's a really handy chart in that book, in the cannabis chapter. It looks like this. I know you won't be able to see it that well right now, but if you forget what we've been talking about, you can always turn to that chapter in the book, and you can look at this chart, and you can actually look at the different things that these different things do. So say I was looking for something that helped with digestion, I could look at this chart and look, say for example, like intestinal antiprokinetic. Well, it's right there that is stimulated by CBD. So if I wanted to slow down diarrhea, then I could use CBD to do so.
Yeah.
So this chart is really, really helpful, and I'd encourage you to utilize that chapter in the book or purchase the book if you don't have it yet.
And that particular, pie chart is out of Trends in Pharmacologic Science, 2009. So it's extremely well done, and it's done by the folks in Israel and Italy, which has done almost all of the very best research until really recently. Because ever since the hammer came down against cannabis in the 1930s, it's a complicated story, but I talk about it in the book, Solving the Brain Puzzle. It's been really hard for folks to research cannabis in Canada and the United States. So we have to look elsewhere. Often, most of the best research has been done in Israel and Italy, although those other parts around the world are getting better and better at it. And there's good stuff coming out in Canada and the United States now because it's much more open. CBD is open in almost the entire United States, whereas both are available in Canada in most scenarios, and so now they're legal. It's much easier to research something that's legal, and it isn't a highly controlled drug. So as that works, as it goes. So we've talked a fair bit about CBD already. One of the questions was about CBD knowledge, and it's probably easier to think of what CBD might not do than what it does, because it does so many things by the way it acts. I've given you the glimmers already. It may be fabulous for your arthritis pain because it's anti-inflammatory. Okay, it calms down inflammation without any nasty side effect. It doesn't have the nasty side effect of the non-steroidal anti-inflammatory drugs, things like Celebrex or ibuprofen or naproxen. So that's a real plus. Okay, it doesn't have the risk factor on it. It's quite useful even in psychosis. Okay, so if I had schizophrenia or my son was newly diagnosed with schizophrenia, I would hope that they were given CBD in considerable amounts. So the other benefit with CBD is you can use huge amounts, not just 5 10, 20 milligrams a day, you can get up to 500 milligrams a day. And sometimes they're up in that high amount of pure CBD, for example, in the drug Epidiolex, which was approved a year or two in the United States, accepted by the FDA to treat seizures of a specific type, Dravet syndrome, and the other one, Gastaut-Lennox syndrome. So those are typically in children, but they can happen older. And those are the ones that gave the famous story of Charlotte's Web, right?
Right.
Done by a group of cannabis growers in Colorado who had great success with a little girl who had seizures, hundreds per day, and was able to almost completely resolve them. And I have seen now quite a number of children, mostly referred to me by a pediatric neurologist, and started them on CBD, and it's really helped their seizure control. Because what nobody tells you is that even though we've got 20 to 25 anti-seizure drugs, they only control about 60-65% of seizures. And the rest of the people are hooped. But CBD will often step in and make a difference in that whole control scenario.
Okay, the next question was also CBD related. Can CBD be helpful as a topical on joints?
Well, sure, and later on, or if we don't get to it this week, we'll get to it next week. We've got about 6 delivery methods that I talk about in the book. Everybody's most used to, of course, smoking or vaporizing the medication, but you're able to use it topically in many cases. Often better if you can put it with an oil which is well absorbed, but it's interesting because it often will make a real difference topically. And often you can get away with some THC in the CBD topically because the THC has its benefits as far as pain relief, and I would try topical in many cases to see what it does. And then you're mostly going to be using an oil. And so I'm hoping that you can find a way to do the oil. My big preference, probably CO2 extraction. It's getting more and more reasonable in cost. I'm not happy about people, taking it out with butane and all these other petrochemical products, because you can't get all of that stuff out of it, because it's pretty risky for you. Just like using gasoline to get high with, a risky game, and lots of injury problems. Remember my background in anesthesiology, which is a close cousin of toxicology. So don't mess yourself up with new problems. So using it topically, you can use almost any amount without a problem, okay? The big advantage we have in Canada now, and it's present in most of the states in the United States as well, and even in parts of the UK, Europe, and Australia, we can get definitive measurement of what's in the product. Okay, so if you can buy an oil, it might be almost completely CBD, might be almost completely THC, then you can mix and match the way you want to. Now you can get the terpenes. The terpenes is probably going to be a topic for next week because it's very subtle, although it's getting really important. And that's where you can get your special purpose entities out of cannabis from the terpenes. And some of those terpenes you can get from other things. One of them is really good from lavender. One of them is really good from pine trees. Okay? So it helps relate you into those special niches or areas that you've got about it. So using it topical, if it isn't adequate topical and you still got access to a cannabis plant, then use the roots, make a concoction or deconcoction, okay? Because the root component has a triterpenoid in it, which can work and even works on gout. And not many things work on gouty arthritis, but it can do. And often that is another adjunct for using it topically. So topically, you've got almost no worries at all about drug interactions, getting high. And so that's a big plus for trying topical, but you'll need an oil. You can't really smear the plant on.
Okay, so I have a question regarding the decoction of the roots. So when I think of that, I think of have you heard of Rosemary Gladstar? She's a herbalist.
Yeah.
So I think of her decoctions where you just put the herb in the water and you leave it to sit.
Yeah.
Would you do that but with oil because you're saying it needs to be an oil?
I would use an oil because you know, the terpenes are more water soluble,
Right.
whereas the CBD and THC are almost completely lipid soluble. So it's a
Okay.
little bit which one you want. I would probably end up, for the roots, using an alcohol base.
Okay.
Okay? And that will be the best way that you can get it out. And then you can put it in a variation of water soluble, would probably be fine. So then you're getting creams that give you a better choice. And then follow up the alcohol maybe with olive oil, coconut oil. Those would be a couple of the favorites. I'm an old emu farmer, and so I would
Yeah.
use emu oil, but not everybody has access to that. I get that. Some of the folks in Australia might,
Okay.
and a few Canadians.
So, following that up, some have asked, what can we expect re the bioavailability of topicals?
Well, I mean, that's an incomplete variability. Even when you take a herb or a medication orally, will have a lot of variability in bioavailability. So if you want a precise number, now you're thinking drug-wise, effectively,
Right.
okay? But if your safety margin is big, you don't have to worry about how much your bioavailability is. So if you're using a primarily CBD strain or other components from the plant and you're not heating it, then you're not going to have much problem with either CBD or THC. Because to be activated, those need to be heated, all right? So bioavailability, mostly you just need to try it and see if it's effective. If it isn't effective, you might try a higher dose, a more concentrated amount, and then see if you get benefit. Because the safety margin is huge, because the skin is a natural protectant. And this is eventually going to get really important for people, because some of the terpenes, and a little bit even with CBD, are antimicrobial, antibacterial.
Mm-hmm.
So the one that comes to mind is there's a couple of terpenes that are very effective against methicillin-resistant Staph aureus. Well, that's a big deal because we're running out of antibiotics that will work on that. So if you can do something at home to keep these under control, or if you're unlucky enough to have a chronic wound problem, then that starts to make these a possibility in the range of things. So bioavailability mostly means how much is available to act on the body. And your end result that you want is comfort in that joint,
Mm-hmm.
in what you've described.
Right.
Yeah.
Well, our next question is from someone with multiple sclerosis, and she's saying that CBD has been really helpful with her pain, but she's having difficulties due to swallowing, so she was looking for recommendations to help her with the swallowing.
For sure. So it's likely you're pretty much going to need to get it orally or rectally. Okay? Rectally has its own relative problems, and it's also an even bigger variability as far as availability. What I would suggest is you look at some quality CBD oil, and further to one of the other questions, it doesn't matter really whether it comes from the hemp plant or the cannabis plant. These are the same species, okay?
Mm-hmm.
It's just that hemp by definition must have less than 0.3% THC. And then the rest can be CBD. But you can get strains of cannabis which are high in that, or you can extract them out so that you've got primarily CBD in the oil. So once you've got a high CBD oil, and most licensed distributors in Canada sell you a 20 to 1, so 20 CBD to 1 THC, or 25 CBD to 1 THC, virtually no THC. There's a whisper in there. Don't worry about having a whisper in there because it won't be a problem. So once you've got that oil, then I would suggest you make a quality smoothie that you like. Make it the right thickness as far as your swallowing challenges, and you're probably going to do just fine at getting the CBD in. The other choice is if you've got a concentrated oil, you can just put it in your mouth and leave it in around your gums, under your tongue. And that will go a long ways. So the one that I use when I travel, if it's to a country that has a Sativex capability, and that's about 30 countries in the world, virtually all of Europe, Australia, New Zealand, Mexico, Canada certainly. All of those countries allow you to use Sativex, which is 50-50. It's 50 THC and 50 CBD, and that's a little spray that you take under the tongue or in the mouth. And you can get most of the benefit. Sure, you might swallow a whisper of it into your saliva, but you can get the benefit within the mouth because it's absorbed through the skin. Because remember, the CBD, it's best in an oil, of course, because it's lipid soluble, as is THC. And so that's another secondary way to get it in. And some people would even use it in a nose spray.
Right. And then from our resident dietitian, Denise, she recommended taking it in a smoothie or with pudding, or just simply, as Bill said, just letting it sit in the mouth.
Yeah. And if you hear any chopping noises in the background, I'm a lucky guy. Denise is making more salsa.
Yeah.
She makes fabulous salsa, and you can hear the chopping in our background.
We should just check, see if there's any questions on here. Okay. I used to take Nabilone to help my neuropathic pain.
Sure. So Nabilone is a synthetic THC, all right? And so it has its own attributes. It was a big deal because being synthetic, it was somehow safer than the THC from cannabis. So it got much better accepted. It became a acceptable drug to be used. And I've written the occasional prescription to someone traveling because they're controlled, for example, on their cannabis, medical cannabis here in Canada, but now they're going to travel to the United States or to Mexico. Well, they can't take their cannabis, even though it's approved in Canada. That's a national acceptance for safety, and it isn't approved in those other countries. So then Marinol will sometimes work in that scenario, but I don't like it in somebody that's cannabis naive, because they're going to have a pretty unpleasant trip or scenario. And it hasn't worked out nearly as well for pain control as we would have liked. So it's still on the market, but it hasn't changed the world by any stretch of the imagination. And you're going to be much better starting with a 1-to-1. So Sativex, Sativex, because remember it's in most parts of the world. Each spray has 2.7 milligrams CBD, 2.5 milligrams, actually they're the reverse, of THC. So 4 sprays, for example, that would be my 10 milligrams at bedtime. Okay, of each, approximately, and tends to work well for sleep, antispasmodic, which the MS people will really appreciate. At the same time, it handles headaches, which are really common in MS, and at the same time, it also makes quite a difference to calming the bladder down through the night. Maybe less trips to the washroom through the night, which gets more sleep. Quality sleep is really important. And that's one secondary benefit I like about cannabis. I think it's more towards natural quality deep sleep. And I'm a huge fan of that because that's when the brain detoxifies. It fires up the G lymphatic system, squeezes the brain like a sponge during deep sleep. If you take it with most sleep aids from the pharmacy, prescription ones, mostly it takes away the quality deep sleep. Non-steroidal anti-inflammatory drugs take away the quality sleep, and many of our pharmaceutical medications mess up sleep. Consequently, I'm a bigger fan of inducing sleep with cannabis if you need something to assist it.
Okay. Would CBD help with my shaky hand?
Possibly. It depends on the shaky hand, type of tremor, essential tremor. It doesn't work in everyone. My premise of what a tremor is, because when I move my hand up to touch the top of my head, I'm using a whole set of muscles, not just the big muscles that move it up there, but there's a whole set of muscle pathways counteracting that so I don't go slam and hit my head hard. And it's the controlling minor muscles, but really important, often are losing their emphasis or input from the brain. So when you don't get the controlling, you get loss of it and you start to get a tremor. Okay? So the CBD may help a tremor. It can be dramatic, what it may do with Parkinson's patients or some tremors patients, but the thing to do is to try it. If the CBD isn't enough alone, you might end up trying some THC. again, that 1-to-1 is usually going to be enough to add the THC in. Again, still best, take it at bedtime, because then the trippiness and the drowsiness part of the THC will be mostly worn off by morning, and it'll be worn off a lot more within a couple of weeks as the body adapts to it. The secret being, start small and work your way up. If you're going to do it on CBD only, you can take it 2 or 3 times a day. CBD doesn't last as long as THC does. So you can eliminate the CBD in the body in 2 to 3 days easily. That's roughly 5 half-lives. Whereas the THC, it's going to take longer. Yeah.
Right. Over the years, I found a way to make a topical cream with essential oils and cannabis for pain relief that also works as a fun sexual lubricant. That's, I believe, a healthy. That I believe is healthy. What is your medical opinion on that?
Well, I'm not sure which part you're asking, but okay.
Well, given that it's antimicrobial, I would wonder what its impacts would be on the vaginal microbiome. Because you wouldn't want to overdo it with antimicrobials in there. You might end up disrupting some of the necessary species, but I don't really know. For example, like some of the most important species in the vaginal microbiome are lactobacillus, and I have no idea what the impact on lactobacillus would be.
I don't think any of us would. You know, it's not such a potent antimicrobial. You're probably getting some absorption because certainly, you know, the endothelium and the skin layers around both the penis and the vagina are very thin. So absorption's really quick and really much more so than it would be on the skin on the back of your hand, for example. So treat it almost the same as you would be if you're treating it in the mouth. You've got a thinner lining of columnar epithelium, so you'll have relatively quick absorption. And stay away from irritants, alcohol, these sorts of things, because if there's a little cut or nick, it's going to hurt a lot.
Yeah, I would also wonder about which essential oils you're using, so definitely don't use cinnamon or clove or oregano.
Yeah.
Definitely use something gentler.
I wouldn't go near those, you know, and if you're using oils, ylang ylang, you know, a relative aphrodisiac type oil, you know, the aromatic oils are really quite good.
That's a good idea. What would it do for someone with diabetes?
Okay, well, we know that the CBD and even to some degree THC, but cannabis in general will often improve insulin sensitivity. And most, certainly type 2 diabetes, is an insulin resistance problem. So you may reduce your blood sugar by using regular, especially CBD, because it really makes a difference to that throughout the body. So it would be a reasonable mix to start, and then maybe with the help of your healthcare practitioner, you can taper down perhaps your other medication which is being used. It's a little more tricky to be doing it in the presence of insulin, because you're going to have to adjust the insulin some if you're making that more stable and reducing insulin resistance. So those are especially need to be done carefully in the type 1 diabetic, which is a problem with pancreas secretion of enough insulin, whereas in the type 2 diabetic, it's more stabilizing the membrane, reducing the insulin resistance. So it's a useful agent, you know, to use in the mix of a diabetic, because, and they maybe need to be on it because maybe they've got some end-stage peripheral neuropathy, which is really quite painful and unpleasant often, and it commonly happens with diabetes. And you might be able to get away with topical in some cases on the hands and feet, which is where it usually starts.
Next question. Can you use it on your pets if they have arthritis?
Of course, of course. And people do use it for their pets. And people buy it for themselves and they use it on their pets. I don't have a problem with that. And you may be able to use it topically, but you may need to use it some orally. So I would start with the CBD and just see how that goes. It may be enough. We know that as far as the anti-inflammatory and working it over time to reduce the overall excess inflammation in that joint for the pet, CBD is a good place to begin. and it may be enough all by itself. You may need some THC in it. Again, 1-to-1 is probably enough.
Mhm. Okay, I am a certified cannabis coach in Calgary, educating and empowering people to engage with plant medicine mindfully. Happy to connect. Thank you for your live.
Okay.
Great, great to have you, Kim. What is your opinion of Rick Simpson oil?
Well, Rick Simpson oil, it's primarily pure THC in my experience.
Yep.
Okay? So if you're going to start somebody new on it, you better start really small and creep your way up because it's a fairly major dose. Rick Simpson primarily developed that to help people in the fight against cancer. Okay? It's very few cancers that it's enough on its own. It's a factor. High CBD can be really quite useful in glioblastoma. That's a cancer of the brain and the glial cells. And it can be useful topically, but I wouldn't use it as the only adjunct. In the really good book on integrative oncology, Dr. Donald Abrams, oncologist at the University of California, San Francisco, and Andrew Weil, one of my mentors in integrative medicine, wrote a fabulous book, and it's got a second edition now, and I quote it regularly in my own book, Solving the Brain Puzzle. It mostly is an asset in a cancer patient if it allows them to tolerate their other treatments better. Okay? So they may end up tolerating their radiation therapy better, they may end up tolerating their chemotherapy better, but using it only is not optimal use of the cannabis. You want it mostly as an adjunct to other treatment modalities, and it would be unfair of me to say, because they outright say it's rarely a solution in most cancers.
Mm-hmm. Okay. How can we prevent the feeling of spinning that comes with taking medical marijuana?
Yeah. So almost all of the spinning happens from the THC. Okay? More THC, more spinning. I think of the T of THC, even though it doesn't stand for it, I say it stands for trippiness. Because if you remember that, that's all you need to know. And if you're spinning, you're using relatively too much THC, or you're not using enough CBD, because the CBD seems to calm down the spinning or the trippiness that occurs at the CB1 receptor. And that's what makes all the difference. And that's why increased use of CBD is going to make many more people able to tolerate it. And the other magic thing to do is slow down, reduce the dose. And that's another reason why you may end up learning more about using it orally or another way other than vaporization. Vaporization, whether it's smoking with a toke, or through a vape unit, whichever way you're taking it in, you're mimicking an anesthetic where we use it in a gas matter, because you use the whole lung surface as an absorptive surface. It's almost the size of a football field as far as surface area within the lung, and so you get a rapid spike. And you're going to get really spinny on that if it's a significant amount of THC in that. Whereas if you take it orally, it's going to be a slower onset. So instead of 3 to 5 minutes for response, you're going to be 1 to 2 hours. So don't start topping up the oral dose for probably at least 2 hours, because you may have topped it up and it hadn't even peaked yet. So now you're going to be really unpleasant.
Okay.
So most of us would be much better off if we just started much lower. 2 milligrams THC, maybe 5 milligrams THC, especially for the uninitiated. And remember, the elderly makes a difference. By the time you're 70 years old or so, you typically need 1/3 of the drug that you needed when you were 35, 40. So start smaller, start lower. And, keep in mind the other medications that they may be on, because some of them will vary. Now, if there's one tricky part about CBD over THC, CBD has more effect on the liver enzyme pathways. It tends to slow them down, okay? What does that mean? it means it relatively increases the length of time the drug works in the body. So if you're on a blood pressure pill and you go on a fair whack of CBD, you end up on a bigger dose of blood pressure pill without changing the dose. All right? So that's why you want to do it gradually. You want to do it with your health practitioner's messaging in mind. Or, for gosh sakes, if you've got hypertension, for example, have your own device at home so you can follow it yourself. All right? Because you may need to taper down the dose of the drug if you're using more CBD. It makes a bigger difference when we get to opiates. Opiates are very interesting in that if you take, say, that 1-to-1 mixture of THC to CBD, you will increase the strength of the opiate acting on you 4 to 10 times. Okay? That doesn't mean you're necessarily going to stop breathing from the opiate. It means you need a lot less. So maybe half of a Tylenol 3 or an MTEC 30, or 10 to 15 milligrams of codeine instead of 60. It's a big difference. So think of it at least as 4-to-1, but even up to 10-to-1. It's a huge advantage in the end of life with somebody that's on a large amount of opiates, because often they can reduce the opiates. They get the benefit from the cannabis as far as reducing anxiety, maybe muscle spasms and those sorts of deals. So it's a matter of having someone help you assist that. It's wonderful to have the cannabis coach from Calgary because they can help you through that. Unfortunately, most physicians aren't any good at that. Mm-hmm. Now, you can learn a lot about it. Get a copy of my book with the 50 pages. That'll get you a long ways into it, but you're going to end up coaching your physician in many cases, or maybe you've got a healthcare practitioner that's informed and they're getting more informed all the time, which is fantastic, because rather than just saying no, they start to say, well, maybe, but let's, and my advice to you is the same, start small and creep up on the cannabis side.
This is probably one of the most important things I've heard so far, because I know pretty much with all of our arthritis clients who have been using it, they are on things like blood pressure medication or other types of medication. Or I'm also thinking of the autoimmune arthritis patients who are on opiates or other types of painkillers while still using cannabis, because the reality is sometimes you still need extra support. So that's something I hadn't heard before, and I really
that interaction's really tremendous, and it's really helpful. And once you understand those mechanisms, it's incredibly safe. The one thing I didn't mention early on, and I want to really emphasize this, cannabis is incredibly safe because there's virtually zero, repeat that, zero amount of receptors in the breathing and heart stopping part of the brain. This is what kills people with opiates or narcotics, with benzodiazepines, with barbiturates. They stop people breathing. None of us do well without breathing. We're not getting any of that magical oxygen.
Yeah.
All right? So consequently, it's incredibly safe because it doesn't do that. So start with that in mind, but don't aggravate things. If you're on a big dose of a benzodiazepine, for example, you better start to taper it down before you get into very much CBD, because it could kick it up into an increasing problem. Same as it's risky and to the point of potential death to mix benzodiazepines and opiates. And yet people end up doing it a lot, for their sleep medication plus their narcotic and all these things. And it's a very risky scenario. And cannabis is much more forgiving to bring into the mix rather than one of those. I'm not a big benzodiazepine fan, even though I've researched on them in the past and worked with people at point of return to help get people off them. They don't have any great attributes to them long term. Short term, anti-seizure, anti-anxiety in the operating room or whatever, okay, fair enough. But long-term use, terribly addicting, lots of downsides. I'd much rather people went down the cannabis route than followed that route.
Yeah, agreed. Would you still get the same benefits if you used it every other day instead of every day? CBD, that is.
You won't get quite the same benefits because its half-life is 4 to 7 hours, okay? It depends on the individual, right? So you might get it every second day, but there's no real brilliant reason to use it every second day. Many people will need to use it 2 and sometimes 3 times a day, okay? So to get maximum benefit if you're anti-seizure or whatever. If you're using it every second day, your amount is going way down. If it's THC in it, you might get away with every second day because it's got a much longer half-life. But there's no real advantage to spreading it out every second day as opposed to every day, other than bringing down the cost and how much you need. It's easier to use a medication to get a smooth amount or drug concentration in the body, or relatively smooth, you know, little bumps, little bumps, little bumps, than it is to take this great spunk mountain all the way down to zero, great spike mountain all the way down to zero. We try and train anesthesiologists and physicians alike, get a hold of the pain before it peaks. Or if you get a hold of it, stop it from peaking again. It's no benefit and it's very unpleasant for the individual. There's no magic to getting that spike back in every second day. So I would encourage you, if you're thinking every second day for CBDs, get over it. Use it twice a day, more likely.
Are we better to buy cannabis from a local dispensary or online?
Well, that's a very open-ended question, as you might guess. There's roughly 50 licensed producers in Canada, so if you have a medical document from your physician or nurse practitioner, then you can order from the licensed producer online or over the phone, okay? They do not have storefronts, okay? The storefronts that exist in Canada are 2 types. There's a government responsive one, and then there's, you know, or government approved one, and then there's a few that aren't so much. And the variability in those can be very dramatic. Some are superb. You want to know what is the lab tested amount that's in the product that you're looking for. How much CBD, how much THC, and see the numbers. Do not let anybody try and tell you that because it's indica or sativa, that it's going to be just fine for A, B, or C. No one can tell, and this is out of the words of one of the very best cannabis experts in the world. No one can tell what's in a plant by looking at it. So we look at it for phenotype, that's the shape of the leaves, the height, and so on. But there's been so much interbreeding between both sativa and indica that until you measure it, you have no idea. Okay? And so then where to decide? I would prefer to get it from someone who can confirm and is legally or pharmaceutically have it measured so I know what I'm getting. And I know that it's consistent. I don't want to buy it from someone who gets it from Mr. Jones over here this week. 2 weeks later, they get it from Mr. Smith. They say it's the same, but it may be very different as far as its components. So you're not going to have a happy method. The whole reason they were able to, in the 1930s, they put a spin on the 1930s. They put a spin on that herbs were less predictable than pharmaceutical drugs. Mostly that's not as true as they tried to make it out to be, and we've kind of gone whole circle, and that's why there's an advantage, and we'll be talking more about it next week if we don't get to it this week. There's a real advantage to the whole plant, the so-called entourage effect, where you're getting some benefit from the CBD, some from the THC, some from the other CBD derivatives or cannabinoid derivatives, or also from the terpenes, or even from the triterpenoids, as I talked about in the roots. Okay? The whole plant has some advantages. So currently, we're trying to move it, in some circles, we're trying to move it back into the drug model, where we take one thing out of the plant. We burnt ourselves really badly when we did that with valerian Valerian. That is the name of the plant or the herb that has the original source of Valium, okay, or diazepam, same thing. So when we took Valium out of it, we only got a so-called agonist, meaning it's active for what you're looking for. But usually the plant has a group of agonists in it and a group of antagonists. So the two together minimize almost all the downsides of that herb. So the valerian will be almost zero addiction problems, whereas you take out the one component and you get huge addiction problems. And I can talk about addiction as well, and happily, addiction from cannabis is much lower than they thought. I can dispel all possibilities. It's no longer looked at as an entry drug. There's still old news out there talking about it being an entry drug into addiction. It's not, okay? Addiction is maybe 8 to 9%, whereas in narcotics and benzodiazepine, it's 30 to 40%. So much less addiction, much easier to taper off. In fact, I predict that one day we'll be using CBD and these other agents to help people taper off other medications. I have been able to help people on a large number of either narcotics and other painkillers gradually get off almost all of them, including especially from the addiction potential by the use of CBDs.
Great. Is there a CBD brand or company that you would personally recommend?
Not really. You know, if you want the pharmaceutical grade one, and your physician may prescribe it easier because they can do it on their duplicate prescription pad in Canada and prescribe Sativex, which I mentioned before. It's by GW Pharmaceuticals, originally out of the UK. All right. So if you want a gold standard one that your physician can write and your pharmacist can fill, that's the one to go to. That's the where to start. And if that is effective and you want to branch out and find other subtleties within its own, then you need someone to write you a medical document and work with the licensed practitioners. In today's world, we're starting to get some very knowledgeable people in these government-approved shops, and they can tell you about it. I was in one, for example, in Seattle a couple of years ago. I, of course, couldn't take anything with me, so I went there, and once we got through all the correct paperwork, they're really knowledgeable of what they have, and that is making it much better. So the tip for you is you want a reputable outfit and brand which is consistent almost one time to the next.
Okay. Where can physicians be directed for information re prescription, writing, and dosages?
Well, I think a really easy way to start is a copy of my book. There's 50 pages of the 600 and many, many references within it, along with a lot of good advice by many of the people that talk about it. And that's a place to begin, because you need a baseline knowledge first, and then you can get your feet wet and start. I've had a lot of physicians, once they've read that chapter, they say, well, I'm going to start with Sativex, okay? Mm-hmm. Most family doctors will have 2 or 3 MS patients in their practice, okay? It's recognized, you know, nationally and internationally that this is a good drug to use in MS patients. So that's a place to start. Another place to start would be in your patients with sleeping problems or pain problems. You could start with that medication. Once you get that in some degree of knowledge and start to learn about that, and it's very titratable. Each squirt, you know, that you take in the mouth, it looks a little bit like a Ventolin inhaler, okay? But you don't have to breathe it in the way you're putting it into the mouth, under the tongue, or in the side of the angle around the gums, okay? And you're getting a nice absorption, and you're getting the effect in probably 30 minutes max, and if you need more, you can take more. And it's going to be gone mostly in a couple of hours, certainly in 3 or 4 hours, okay? So now you've got something which is, I call it titratable, meaning you can start small and work your way up as you need to. Those are the places for physicians to begin. because you want to get that base knowledge. And it's really important that you do, and I really applaud you for looking at a new place to help your patients. I have not seen anything near as useful in my chronic pain practice as cannabis, because it fits into the mold of what we need to do. We just need a baseline degree of knowledge. And there is some degree of knowledge and training going on, increasingly amount. They'll have people sponsored by the licensed producers. I dream one day we'll have it sponsored by, the government of Canada or someone, so that we get those learning curve models. Typically we've had them by the drug salespeople. Well, those don't exist near as much in the cannabis world, but they are partly there. So you need to do the information seeking yourself. I took a couple of courses. I mentioned those in the book. That's a brilliant way to start. You can do it in the comfort of your own living room. I talked on cannabis to several hundred physicians in Italy in 2017. Talk about a little bit about that in the book. But you want that baseline knowledge. Once you get that baseline knowledge, you're free and away. And it's really safe to start to learn about it. It doesn't need to have that terrible angst or pain about it, that it's an entry drug, because it's not, that it's horribly addicting, because it's relatively not, and you can start to work forward.
All right, so we should make this our last question. Can CBD be harmful or beneficial for someone who has had acute liver failure and has multiple sclerosis?
Okay. Interesting, tricky question. Okay. If you've had acute liver failure, I'm getting the concept that it must be abating some. You're going to have to start very gingerly and small with your CBD. It's still going to help your MS symptoms quite a lot, but the liver failure means that you've got relatively less ability of the liver, which will be impacted by the CBD. Remember, CBD can slow down the liver enzyme pathways. The other piece that you should know about is you should learn, and if that means contacting Christina at mindmoodmicrobes@gmail.com or the website Mind Mood Microbes, because our gut microbiota, the bacteria within the gut, can do about a quarter of to a third of our detoxification. So that's another adjunct to help out with the acute liver failure. And the other thing is someone helping you understand which drugs are cleared primarily by the kidney as opposed to the liver, because hopefully your kidneys are still working well. So it's a gradual road. Don't give up. You can get a new liver potentially in 1 to 3 months. So, we get a whole new body about once a year. So don't give up with what you got today, folks. Give yourself a chance. So we've got a lot through things today. Once again, if you're not sending this or someone isn't on Facebook, they can go to drbillcode.com, look under blog, and all of our programs are listed there. They're also made into an audio, what's the right name for podcast equivalent?
Yep.
So I'm getting good at some of those terms now, because when we travel long distances in the car, we just got back from a wonderful month in the Yukon, then you can learn a lot as you go.
Yeah, and we didn't get through all the questions today, but we will come back to this topic next Tuesday, and we'll get through the rest of the questions then. So for now, thank you so much for joining. Thank you for submitting your questions, and we'll see you next week.
Have a great week.